Good morning, everyone. I have the pleasure of speaking today with Dr. Sharon Hausman Cohen, who's Intellex DNA co founder and medical director. Welcome.
Thank you. Thank you so much for having me. I'm excited to be here today and to talk with you about how you're using genomics or Intellex DNA in your practice and how it can improve your patient's health journey and health outcomes. Tell me a little bit about how your transition to integrative or precision medical practice.
So I was working at Mount Sinai Medical Center here in Miami Beach. I was working way too many hours. I wasn't dedicating enough time to my patients. And as you know, when you don't have resources like Intellex DNA, there is a lot of trial and error that we have to do before we come up with a diagnosis or the right treatment plan. So one of the reasons that I'm so excited to be using Intellex DNA is that we get the report, we know what's specific for that patient, and we can target that.
Yeah, I think that people want more precision in their life. When you think about chronic illness, when you think about dementia, heart disease, autism, depression, anxiety, we come up with these algorithms, but we don't really say what is the root cause. A genetic illness is an illness that is transmitted by a gene from parents to children. And so if you find a cure that for is a disease that is caused by one gene, it's going to kind of work uniformly. But chronic diseases that are common, heart disease affects so many people, diabetes, so many people, cognitive decline, again, depression, anxiety, they're not caused by one gene. They're caused by the combination of multiple genes interacting with each other in environment, and there may be different causes or that are part of the puzzle, sometimes even more. And so the benefit of using genomics in chronic illness is now you can say, okay, you have anxiety, but it's not because of your serotonin. Your serotonin pathway that's known to contribute to anxiety looks really good. It's because of your adrenaline pathway. So for you, we want to talk about how do we lower your adrenaline? How do we do it with supplements? How do we do it with lifestyle? The big advantage of genomics is all of a sudden we take medicine from here's what we do for depression, hypertension, diabetes, heart disease to here's what we can do for you to get your chronic illness under control. And that is bringing medicine into the current century. I mean, if you look at medicine, there's so much that hasn't changed in 100 years, and we've got to change it. If you look under diabetes, on, for example, 23andMe, they talk about one gene, TCF7L2. Don't worry about the names. But that gene does increase your risk of diabetes more than twofold, so it's important. But that one's in 47% of the population. So again, it's just one piece of the puzzle, and they don't tell you what to do about it. So our big difference is our focus. It relates to things that you want to know about if you're trying to optimize your health. It's not about ancestry. We do a lot that relates to the brain health, which is, again, very unique for Intellex DNA. And most importantly, it's actionable and evidence-based. That approach means that you won't miss nutritional causes, gut causes, inflammatory causes that are mimicking as brain symptoms. I think that one of the really fun things is you see outcomes that you don't even expect. So we have had patients come in and they think they're having Alzheimer's, they think they're having some cognitive decline, and it ended up being problems with their detox pathways, problems with their gut. And they actually had genes that gave them kind of a negative risk for Alzheimer's, made their cognition better. And as soon as we addressed some of these different nutrient things and cognitive contributing factors from gut and inflammation, they were better. So I think that there's lots of exciting medical mysteries that get solved from gut to brain symptoms and everything in between. And it just depends on what patients' basic concerns are.
How do you compare Intellex DNA to other existing platforms on the market?
So Intellex DNA's mission is to help people optimize their health, not just on the level of nutrients. So some of the different genomic platforms out there specifically target nutrigenomics. Some of them will target specific lifestyle things like, what kind of an athlete am I? Am I endurance or, that kind of characteristics. And Intellex DNA is the only company I know of that has extremely extensive work in the field of brain science. And that is really, really important because of what's called the blood-brain barrier. So we have like a whole separation between our blood and our brain, and that's to keep things out of our brain. But it means you can't do blood tests and kind of know what's going on with the brain. So if you're looking for optimizing cognition, if you're looking for optimizing depression, anxiety, ADHD, again, autism, anything that relates to the brain, Intellex DNA focuses on that.
Yeah, again, impressive. Actually, I asked some of my patients for a few questions. The first question, and how does Intellex DNA protect the privacy of their clients?
Yeah. So Intellex DNA takes privacy concerns very seriously. Many companies make their money, in fact, by selling your data to other organizations. Again, the direct-to-consumer reports, they're being sold directly. Your information is being sold directly to pharma. Intellex DNA, when you get your kit, and it's just a buccal swab, it's a cheek swab, it is under a barcode, and our lab has it stored literally just under a barcode. You will not ever have your results shared unless you explicitly say, please share this result with another physician.
Yeah, I know you guys are very precise on how to order the test. So there is no information, even when we place the orders, we have to like scan the barcode. There is no patient information when I send out a request. So the next question, since the report is only a once in a lifetime buccal swab, how can any future discoveries be shared with the patient?
So there's two different things that happen. We have our chronic medical overview, chronic diseases and medical overview. We have our mental wellness. We have our cognitive decline. As well, there is a gene that we want to add information on to the report. We will put it into everybody's report that has it and update the report. The main thing that is really important to understand when you're ordering a DNA test is your DNA doesn't change. If you get the cancer, then obviously that gene changes. And so it's more about the utility that you can use your report when you're young and you're saying, okay, I want to be proactive and I have heart disease running in my family, and you find out that you have a gene that affects calcium buildup in the arteries, and you take vitamin K2, and you feel like you don't have good energy. And so we optimize some of the nutrigenomics and some of the things that relate to your mitochondria and different things. And then you get older and you're like, okay, I just got my bone density back, and I think I'm ready to talk about what can I do so I don't go from osteopenia to osteoporosis. And so you can use it at different times in your life. At least 85%, maybe even 90% of the time, people see noticeable improvement in something.
How do you justify the higher cost in Intellex DNA?
Intellex DNA is a validated report where all of the SNPs that we report on, all of them are performing at that over 99% accuracy. So that's really helpful to know that the technology not all technologies are the same, and I won't go into the details, but we do use a very, very accurate technology and spend time on validation. Intellex DNA, we're taking hundreds of thousands of hours of work and putting it at your fingertips and making it actionable. So what patients are paying for is not the genomic sequencing. Genomic sequencing has become cheap. Where Intellex DNA shines is it allows a physician or a licensed healthcare provider to say, oh, okay, this is what this gene does. And it's not just what the gene does. This variant makes you have more of this gene product or less of this gene product. Here's a list of supplements that can then also help you to modulate that gene that can help with whatever we're talking about, whether it be cognition or depression or anxiety. And we also act as even a reference tool beyond that, giving further information about everything in the report, from typical dosing used in studies, references in studies. And so it's kind of like a textbook of personalized medicine that has put in the DNA for that person. Higher cost is that you're paying not just for the sequencing, but for all that information. One of my colleagues who used to be at the IFM as a physician there, now she's in private practice, and that what took her 7 years of trial and error with her patient, one of her patients, we were able to figure out in 45 minutes with Intellex DNA. There's one more factor I'd love to talk about when we talk about cost. When you talk about cognition, when you talk about depression or anxiety, when you talk about chronic health, again, autism, but chronic health conditions as well, the bulk of the cost is borne by the patient. So they showed that 70% of the cost of depression untreated is borne by the patient because they don't go and get job promotions. They are underemployed or unemployed or don't have the quality of life. When you talk about cognitive decline, 1 year in memory care is over $7,000. If you're going to get outcomes, then that's worth it. And one of my patients, it was a child, but the father said for a particular condition he had, they had spent $70,000 running around the country, getting second opinions, trying to optimize their child's health, and that in 3 months with Intellex DNA, they had more progress than they'd had in 10 years with just your trial and error method. So that's why you would do it.
Yeah, no, I agree. I'm in love. It's pretty impressive, both as a patient doing it and also as a physician. It's a lot of information in that report. So I'm extremely happy I did it myself.
So let me ask you, Luis, how, if patients want to work with you in Miami or elsewhere, how do they reach you?
Of course, we prefer like in-person visits, but I also do telehealth. The office is a beautiful location here in North Miami, but they can send me an email to Dr. Perez at hbettermiami.com, or they can call the office at 305-456-4606.
And if there are people outside the Miami area or outside of Florida or looking for Intellix DNA providers for children or adults, they can go to our website, www.intellixdna, and it's INTELLXX DNA.com, and put in where they are based, and we can give them a list of doctors doing both telemedicine and live visits. And we have both. We have naturopaths, we have allopathic doctors, we have nurse practitioners, we have a wide variety of practitioners to meet different people's needs. Reach out to us and look at our website also if people want to learn more. It's a great resource. We have a number of publications on our website. We have a number of podcasts if they want to. We didn't really have time for a lot of case studies, but I think the case studies are also fun to do with slides. So there's quite a few on our website that people can use, and know that Intellix DNA will help you be your best self.